HealthySoch.com is pleased to have few words with Padma Bhushan Awardee Dr. T.S. Kler on the treatment available for heart diseases. So, what are the treatments available for heart failure patients?
I'm happy you asked me this question because there are a lot of treatments available for heart failure. Now, whenever you have a patient of heart failure, first of all, we have to investigate that why heart failure occurred. For example, heart failure may occur because person has blockage in the coronary arteries. Heart failure may occur because somebody has a valve problem. Either the valve becomes very narrow or they start leaking. So whatever is the etiology, whatever is the cause, whatever is the treatable cause, we should treat that. That's number one. Supposing you reach a situation that you have done already that particular treatment. For example, if somebody has a blockage in the heart artery, you have done angioplasty or bypass surgery. But even after that, the heart is weak. Then there is a real problem, because there are many patients in the world who have what we call a refractory heart failure which is not responding to the usual treatment. Now, for refractory heart failure, there are three modalities of treatment. Number one is we call it CRT therapy, cardiac resynchronization therapy. Now, this is a specialized kind of pacemaker which we can implant on the individual, and patient of heart failure can feel better. But you must understand that CRT is useful only in around 35% of the individuals. Who are those? These are the people who have broadening of their ECG QRS complex. If the ECG shows broadening of the QRS complexes, particularly more than 130 milliseconds, those patients can be benefited by this pacemaker or CRT therapy. And we have seen that some of the patients respond remarkably well, and this is not a complicated surgery. This is done under local anesthesia. So CRT is one. But if say some patient is not suitable for CRT, then we are left with two modalities. One is the cardiac transplant, which is very much possible in India now. We do in our hospital. We have done already 5-6 patients, and fortunately all have done well. It is a very effective treatment. Now, roughly 5-year survival of a cardiac transplant is around 80%, and 10-year survival of a heart transplant is around 60 to 70%. So it's a good result. If you don't get a heart, for example, now the problem with the heart transplantation is only that you need a heart. Supposing the heart is not available, or the patient's age is more than 65 or 70, then usually transplant is not offered to these patients, but then they can have what is called as artificial heart. It is also called left ventricular assist device, which is being done in the country. We have done that, and a lot of patients have improved. The only major limitation of the artificial heart is that it is expensive. It costs around 60-70 lakh rupees, because the device, the artificial heart machine itself costs around 40-50 lakhs. So usually in a private setup, a patient has to spend around 70-75 lakhs, but in a government sector it will be less, of course. So these are the treatments available for heart failure patients, and if patient has the understanding, they have the resources, lot can be done in heart failure patients.
So, what happens if heart disease is left untreated?
Well, if heart disease is left untreated, obviously, first of all, patient will have very bad quality of life. Ultimately, most of them they die. Heart is something which is the central axis in the person living. If heart is not able to pump enough blood to the body, ultimately people die.
So, what is angioplasty and stenting procedure?
Well, angioplasty and stenting is a procedure which is used to treat coronary artery disease blockages. Now, this is a technology which is done under local anesthesia without any surgery. So we can go into the heart with specialized equipment, and we can open those arteries. Usually, once you have opened the artery with a balloon dilatation, after the balloon you can go and implant a stent. The idea of stent is that it prevents recurrence of the blockage at the same time. It is a very well established therapy, and now more and more patients of coronary artery disease are being treated with angioplasty rather than bypass surgery.
So when is the need of angioplasty, or why is it done?
Whenever a patient has a blockage in a major artery which produces symptoms, or which is likely to produce a heart attack, jeopardizing the patient's quality and quantity of life, those are the situations where stenting is advised.
Thank you, sir.